Russ Evans with you, Golf Exchange, presented by the Honda Classic. And right now it's time for our Jupiter Medical Center Meet the Medical Experts segment. The Jupiter Medical Center is a not-for-profit regional medical center providing a broad range of services with specialty concentrations in oncology, imaging, orthopedics and spine, digestive health, emergency services, lung and thoracic, women's health, weight management, and men's health. Founded in 1979, the medical center has approximately 1,500 team members and over 500 physicians. The Jupiter Medical Center is the recipient of the Health Grades America's 50 Best Award for the past 3 years in a row and the Distinguished Hospital Award Clinical Excellence for the past 9 years in a row. For more information on the Jupiter Medical Center, call 561-263-2234 or visit jupitermed.com. And we're very pleased to be joined this morning by Dr. Ken Gray, holistic physician. He practices alternative medicine. He is on staff at the Jupiter Medical Center. He's in studio with us this morning. Dr. Gray, good morning to you. Thanks for coming in.
Good morning. Thank you for having me.
It's great to have you in studio this morning, and looking forward to talking about holistic medicine and alternative medicine and different ways to treat patients. Give me an idea for what you do on a daily basis.
Daily basis, I practice the mantra, that my dream is that one day patients will visit their physicians, and instead of asking, what can you give me, they'll ask, what can you teach me? So generally speaking, it's an education process. I see a patient, they have complaints. I go through all of it, and I look to help not only the symptoms, which we look at as the branch, but the root of the problem. And so the thing that drives me is helping the whole person. And so that may be food therapy, herbs, homeopathy, acupuncture, Chinese medical massage. Tons of different modalities in my tool belt, and all natural.
And I would imagine in order to treat the person, you got to treat both mental and physical. And they're certainly connected, and you've got to be healthy on both ends to be feeling healthy altogether, right?
Yes, I don't separate. There's definitely a connection. Even in conventional medicine, they're seeing that there's a real connection between the emotional aspect of the human and the physical outcomes. So we definitely treat that.
Talk to me about acupuncture, because I know it's a big part of what you do, and I watched some videos online that you're involved with, and you talk about freeing up blockages that cause pain, and acupuncture helps with that.
Yeah, the premise of it, this 5,000-year-old medicine, is that all pain and disease can be linked to the blockage of energy and blood flow. And energy being life force. So the restoration of the proper flow and balance of that is where it comes from, and that can be done through a number of things. Externally, you can affect the body with acupuncture. You can affect the musculoskeletal processes, the circulatory processes, everything, the lymphatics, all of that. But then emotionally, you can get things flowing as well, because the organs have an emotional connection, whether it's the lungs with grief and sadness, or the liver with anger or unanswered will. You have the spleen, which involves worry. So there is a physical and emotional connection, and the restoring of the balance and flow of qi and blood. That is the foundation.
Very cool stuff. And you've actually done some acupuncture during surgery.
Oh, yeah. I've been fortunate to work with some amazing surgeons, tops in their field at Jupiter Medical, and I think we're doing revolutionary things. So what prompted it was patients that either had liver diseases or allergies to medications and pain meds, and I was called in to not only assist with the pain function, not in lieu of anesthesia, but to support and then help in surgery so that their bodies would metabolize everything well, and then they would come out of surgery not only having healed faster, but without any of the nausea and complaints they would have had in prior surgeries.
Awesome stuff. Dr. Ken Gray is our guest. He's a holistic physician. You can check him out on Twitter, at Dr. Ken Gray on Twitter, at Dr. Ken K. Gray, at DrKenKGrey. It's Gray with an E. So Twitter handle for Dr. Ken Gray is at Dr. Ken K. Gray. On Twitter, he practices alternative medicine. It's our Jupiter Medical Center Meet the Medical Experts segment. For more information on the Jupiter Medical Center, call 561-263-2234 or visit jupitermed.com. And a couple of websites that, first of all, Juice and Essence, www.juiceandessence.com. And at that website, you can get more information on your cookbook, Health and Balance Cookbook, and the healing power of food. Diet is a big part of staying healthy.
Yes, sir. You're correct. I, for the last 3 years plus, My partner Carol Magley and I, we're co-authors in this project, and we've been working to not only represent the balance that food can offer and healing benefits that food can offer, but we've packaged it in a nice, attractive manner. And we've done seasonal books, and the series is called Health and Balance. And the Juice and Essence brand is all about the basics of life and seeing how important that is. So when you look at Juice and Essence, you'll see videos of us and the dinners we've hosted and all of that good stuff. And then you'll learn a lot about the recipes. And in the recipes, we describe how each of the elements of the food can heal the body, what the energies and properties are. So it's a different way of looking at health. Instead of saying, I want to be on this sort of pyramid diet, you might want to say, well, how can I balance myself and what does this food do to me? And then as you learn that, you learn how to apply foods in the healing process of and your goals.
It's a good-looking book. You brought in a hardcover copy for me. I appreciate that. I'll certainly dive into this and try to improve my diet for sure. But whenever you talk about diet and eating healthy, the term antioxidants comes up. Talk to me about antioxidants.
Well, it's one of those definite catchphrases now. Everybody is into antioxidants, and there's so many ways in which to get it. There's higher active foods. There's obviously your fruits and vegetables, your dark leafy greens, and all of that. And what it comes down to is basically the antioxidants battling the free radicals and preventing cancer. I mean, cancer has affected either any of us listening here, and definitely people in my life, and we're definitely at war with it in a sense. We're trying to keep it at bay, or we're trying to keep it from affecting us again, because I know a lot of people have dealt with it several times. And so antioxidants and foods of that level will be instrumental, and that's always going to be, like I said, your dark green leafy vegetables, your berries, your blueberries, and those sort of things. And I think you'll find that there's supplements now that you would want to supplement, because foods, although even if they're organic, you want to look at whether they're genetically modified, and then you want to look at where they're coming from, and then you want to also supplement with some good supplements out there. We recommend Garden of Life.
As a rule of thumb, I would imagine just eat more fruits and vegetables.
Yes. And
eat less of probably the other stuff that aren't fruits and vegetables.
Yeah, well, again, it's balance. Even the meats, the fish, even there's grains, there's super grains out there, millet, spelt. There's things that people have accessible at their general grocery store that they're not utilizing. That's very beneficial. So I would say it's not even just eat more and less. It's definitely a balance and learning the seasons. And in our book, we discuss a lot of that.
There's that term again, balance. Balance in your diet, balance in your life relative to activity. I mean, that's really a term that keeps popping up, and there's a good reason for that, because that's really something you should strive for.
Yeah, and I think it's more enjoyable than totally deleting. Patients come to me and they ask me about wine, and obviously I'll say red wine is better than white wine, and they'll ask me why, and then I'll give them a reason. I'll say white wine has a little bit more, creates a little bit more on the arthritic sort of feelings. You might get a little bit more sore joints from white wine. Red wine has more antioxidants, and I recommend Old World versus New World, or looking at the vineyard. So, again, it's balance and knowledge. And if you don't have the knowledge, then you can't balance. So we're doing our best to try to spread that.
My wife's a wine drinker, and she's starting to get me into some wine, but I'm still a beer drinker. Are there good beers and bad beers?
Oh, yeah. I enjoy and indulge in both. Beers, again, same thing. You want to look at the microbrews because they're going to use less preservatives. They're going to use better strains of hops and barley. A lot of B vitamins, a lot of, the yeast is extremely good for you. Brewer's yeast you can use as a supplement, but now it's in beer and you get a little buzz off it, so that's always fun. I'm one for definitely enjoying life, so I'm not going to be that person that would, shun any good, healthy product that's made from nature's best elements. But, I think choosing beers by virtue of, we're lucky here. We have local breweries like Tequesta Brewing Company. Mm-hmm. They do a phenomenal job.
Right. It's good information for sure. There's more information in the cookbook, Health and Balance Cookbook. You can check it out online, www.juiceandessence.com. Our guest is Dr. Ken Gray, holistic physician, alternative medicine. It's our Jupiter Medical Center Meet the Medical Experts segment. You can follow Dr. Gray on Twitter at Dr. Ken K. Gray, at DrKenGrey. It's Gray with an E. So Twitter handle for Dr. Ken Gray is at Dr. Ken K. Gray. Your other website, www.earthschool.tv. What can we find at that website?
One of my favorite things on there is a letter of recommendation from Dr. Maya Angelou, and then you'll find a lot of videos. And the videos I started myself, I would handhold a video camera, and I would just record things that I felt was interesting because I thought life was bringing me a lot of interesting people, from sports professionals to teachers and just life travelers. And so you'll find random videos there. And I was fortunate enough to be a physician at the